Hello, my name is Nicole and I am a student at Indiana State University in the LPN to BSN program. This is a presentation about human papillomavirus, commonly referred to as HPV. The following presentation is specifically intended for individuals between the ages of 11 and 26 or parents to those individuals. After watching this presentation, viewers should be able to accomplish three specific learning objectives. They should be able to identify the two types of HPV. They should be able to list the four types of warts caused by HPV. And they should be able to identify the 6 types of cancer that HPV can cause. Please stop here and take the pretest to assess your knowledge about HPV by clicking the link at the beginning of this YouTube video. The human papillomavirus, or HPV, is a common virus affecting both men and women that can cause cancers later in life. HPV is spread through intimate skin-to-skin contact and can be spread by infected individuals that do not exhibit signs or symptoms of the virus. HPV is the most common sexually transmitted infection in the United States. Most people who become infected with HPV are unaware they have it. Usually, within 2 years, our body's immune system naturally gets rid of the HPV infection. When our body's immune system can't get rid of an HPV infection, it can cause cancer or warts. HPV types are often referred to as non-oncogenic or oncogenic, based on whether they put a person at risk for cancer. Non-oncogenic HPV types are low-risk HPVs that mostly cause no disease. However, a few non-oncogenic HPV types can cause warts on or near the genitals, anus, mouth, or throat. Oncogenic HPV types are high-risk HPVs that can cause several types of cancers. As stated earlier, in most cases, your body's immune system defeats an HPV infection before it creates warts. When warts do appear, they differ in appearance. There are 4 common different types of warts, including genital warts, common warts, plantar warts, and flat warts. Genital warts appear as small cauliflower-like bumps or tiny stem-like protrusions. They rarely cause discomfort or pain, but may itch or feel tender. Common warts are rough, raised bumps and usually appear on the hands and fingers. They can also be painful and vulnerable to injury or bleeding. Plantar warts are hard, grainy growths that usually appear on the heels or balls of the feet and may cause discomfort. Flat warts are flat, slightly raised lesions that can form anywhere. Children tend to get them on the face, men tend to get them in the beard area, and women tend to get them on their legs. Long-lasting infections with oncogenic type HPVs can cause cancer. HPV-related cancers include cervical cancer, oral cancer, penile cancer, vaginal cancer, vulvar cancer, and anal cancer. Virtually all cervical cancers are caused by HPV. Routine screening can prevent most cervical cancers by allowing healthcare providers to find and remove precancerous cervical cells before they develop into cancer. 70% of oral cancers, which develop in the throat, are caused by HPV. The number of new cases is increasing each year, and oral cancers are now the most common HPV-related cancers in the United States. Over 90% of anal cancers are caused by HPV. Each year, the number of new cases and deaths from anal cancer are increasing. Anal cancer is almost twice as common in women as it is in men. Penile cancer is a rare type of cancer with over 60% of them being caused by HPV. Another rare type of cancer is vaginal cancer. 75% of vaginal cancers are caused by HPV. A third type of rare cancer is vulvar cancer. 70% of these cancers are caused by HPV. There are many reasons to get vaccinated against HPV, but I will discuss a few of the top reasons. One reason is to allow for early protection. Children ages 11 to 12 years old should get 2 doses of HPV vaccine administered 6 to 12 months apart. Children who start the HPV vaccine series on or after their 15th birthday will require 3 doses administered over 6 months. If not fully vaccinated already, everyone up to 26 years of age should get an HPV vaccine. Vaccines are safe and effective. HPV vaccine has a reassuring safety record that's backed by over 15 years of monitoring and research. In the United States, more than 135 million doses have been administered. The number of HPV infections, genital warts, and cervical precancers have dropped since the administration of HPV vaccines in the United States. Preventing cancer is better than treating it. HPV can cause many different types of cancer, and HPV vaccines prevent infections that can cause these cancers. 85% of people will get an HPV infection in their lifetime. Nearly everyone unvaccinated who is sexually active will get HPV at some point throughout life. Approximately 13 million Americans, including teens, become infected with HPV yearly. Please stop here and take the post-test to assess your knowledge about HPV by clicking the link at the beginning of the YouTube video. For access to this flyer about HPV or human papillomavirus, please click the link at the beginning of this YouTube video. Included are the references I utilized in making my presentation on HPV. I hope you enjoyed, and thanks for listening.